Good afternoon. Welcome to our fourth installment in our webinar series on the 8 dimensions of public health. My name is Dr. Carrie Doherty, and I'm the Interim Associate Dean of Community and Global Engagement in the School of Public Health, Bloomington. I'm happy to be moderating these series of webinars. Since March, experts in the School of Public Health, Bloomington have been offering webinars on the 8 dimensions of public health. We're completing these webinars in an effort to provide a better understanding of the depth and breadth of public health. We're hoping to connect with our community partners, local health departments, other academic institutions, and you, the participants. Like today, each webinar will occur between 12 and 12:45 on the fourth Wednesday of each month between now and November. A few logistical items. We want these webinars to be interactive, so please type your questions during the lecture, and we'll have a moderated question and answer session following the lecture. Additionally, closed captioning is available by clicking the link at the bottom of the Adobe Connect platform. If you're seeking continuing education units, those are also available. First, you have to complete the content survey, and then you'll receive a 1-hour credit of continuing education. And finally, we want your feedback on these webinars. So also complete the satisfaction survey following the webinar. With that, let's introduce our speakers. First is Dr. Carol Kennedy Armbruster. She received her Bachelor of Science in Leisure Studies from the University of Illinois, Champaign-Urbana, her Master's of Science in Exercise and Sports Science from Colorado State University, and her PhD in Human Performance from Indiana University. Currently, she's a senior lecturer in the Department of Kinesiology. Dr. Kennedy Armbruster is engaged in promoting, teaching, and evaluating physical activity programming in an effort to engage healthy lifestyles. Next, we'll have Dr. Andrea Chomistek. She's an assistant professor in epidemiology and biostatistics, also at Indiana University's School of Public Health. She received her BA and MPH from the University of Michigan, Ann Arbor, and her SCD from Harvard School of Public Health. Her research is intended to improve our understanding of how to maximize the health benefits of regular exercise. The topic of today's lecture is the evidence and action on the physical dimension of wellness. With that, let's begin the lecture.
Good afternoon. My name is Dr. Carol Kennedy Armbruster, and this is Dr. Andrea Chomistek. And we're here today to talk about the dimensions of wellness, specifically towards your physical health. In past webinars, Dr. Sefrin introduced the wellness model on your left that has the circles all intertwined. And Dr. Chomistek and I are going to introduce a wellness improvement systems model that shows physical wellness in the pink, but it also shows how it integrates into all the other components of wellness.
So the objectives for today's presentation is to first identify the lifestyle factors that contribute to physical health and wellness. I will then examine the benefits of adhering to a healthy lifestyle. Then Dr. Kennedy Armbruster will come back and describe recent trends in physical activity and sedentary time, as well as a case study analysis on activity trackers in a university setting. Finally, we'll provide practical solutions for incorporating movement into your life. Now, Dr. Kennedy Armbruster will step aside for a moment while I go on and present the first part of the webinar, and then she'll return later to present the second half. So as Carol mentioned, it's truly a pleasure to be with you today. My research interests focus on the influence of lifestyle factors, with particular emphasis on exercise and diet, on risk of cardiovascular disease. As such, I've been an active member of the American Heart Association for over 5 years. The AHA encourages everyone to follow Life's Simple 7, which includes management of blood pressure, controlling your cholesterol, reducing your blood sugar, getting active, eating better, losing weight if you need to lose weight, and stopping smoking. In addition, on the American Heart Association's website, you can calculate your heart score by following the link on the screen. So in order to calculate your heart score, you are going to need information on your current blood pressure, cholesterol levels, and blood sugar. If you don't know this information, you can get this information as well as $100 by attending your free health screening through Healthy IU if you or your spouse are an IU employee. To get more information about the health screenings, please follow the link on the slide. If you're not an IU employee, then you can schedule an appointment with your physician in order to find out your blood pressure, cholesterol, and blood sugar. So for today, I'm going to focus on the bottom 4 healthy behaviors because these are most modifiable compared to the 3 risk factors on the top of the slide. However, the great news is that if you can start engaging in the 4 healthy behaviors, then reducing your levels of the risk factors should then follow. While I was doing my training at the Harvard School of Public Health, I led a study that examined the proportion of heart disease that could be prevented if individuals followed a healthy lifestyle, which included being physically active, not currently smoking, following a healthy diet, maintaining a normal body mass index or BMI, consuming alcohol moderately, as well as limiting TV watching. Before I move on, I do want to note that although moderate alcohol consumption is beneficial for heart health, it is also associated with a higher risk of other diseases. So this probably isn't the factor you want to focus on first, but rather try to target the other behaviors before alcohol consumption. So this shows some of the main findings from the study. To orient you a bit, the healthy lifestyle factors are listed on the left. As you can see on the bottom, there's a series of hazard ratios. A hazard ratio of 1, which is indicated by the vertical line, corresponds to no increased risk or decreased risk associated with the lifestyle factor. So if a factor has a hazard ratio of 1, that means it's neither harmful nor beneficial for heart disease. A hazard ratio greater than 1 indicates that a factor is harmful and causes coronary heart disease, whereas a hazard ratio that is less than 1, which appears over here, indicates that a factor is beneficial or lowers risk of having a heart attack. As you can see, nearly all the lifestyle factors are towards the left of the 1, which indicates they are beneficial for heart health. Smoking showed the strongest association. Non-smokers had a 70% lower risk of having a heart attack compared to current smokers. Also, BMI, diet, physical activity, and alcohol were also associated with better heart health, ranging from 20% to 30% lower risk of having heart disease. Most importantly, for following all 6 healthy lifestyle behaviors, individuals in this category had a 92% lower risk of having a heart attack, which is remarkable. I also want to note that although TV watching alone wasn't beneficial for preventing heart disease, after adjusting for all the other lifestyle factors, it was beneficial for preventing the cardiovascular risk factors such as diabetes, hypertension, and high cholesterol. Using the hazard ratios presented on the previous slide, as well as the prevalence of each of the lifestyle factors in the study population, we calculated that 73% of heart attacks could be prevented if individuals would follow all 6 components of a healthy lifestyle. Unfortunately, in the current study, less than 5% of people actually engaged in all 6 behaviors. However, the good news is it's not all or nothing. Even if you can just do 1 or 4 of the behaviors, you can see cardiovascular benefit. So to construct the graph on this slide, we first divided people into 2 groups. People that had previously been diagnosed with diabetes, cholesterol, or high cholesterol or hypertension, which is denoted by the red bars, and people that had no history of having a risk factor like diabetes, hypertension, or high cholesterol, which are the blue bars. As you can see, individuals that engaged in 4 or more healthy lifestyle behaviors and had not been diagnosed with a risk factor had the lowest risk of having a heart attack. However, if we move to the far right of the slide, we can see that for everybody else, for each additional lifestyle factor that they reported, they saw additional benefit. So people that reported 0 lifestyle factors were at the highest risk of having a heart attack. But then just reporting 1 healthy lifestyle factor, for example, not smoking or just eating a healthy diet, cut risk of having a heart attack in half. The bars are approximately half the size when you go from 0 to 1. And as you can see, as you go from right to left, each additional lifestyle factor that somebody can engage in shows benefit for having heart disease. So even if you're doing nothing right now and this list seems really overwhelming, just adding 1 or 2 of these lifestyle behaviors can be beneficial. And if you're already engaging in 1 or 2 of the behaviors, then try to add 1 or 2 more. Finally, although we examined associations between these lifestyle factors and heart disease, previous research has shown that this healthy lifestyle consisting of these components as well as other similar healthy lifestyle components is beneficial for other diseases, including stroke, diabetes, and cancer. Thus, this is an important strategy to lower overall morbidity and prevent premature death at the population level. So shifting back to our outline for our talk today, we encourage everyone to get active if possible. Current physical activity guidelines recommends at least 2 hours per week of moderate intensity physical activity. However, just doing a little bit is beneficial as well. I'm going to let Carol talk about that later, and I'm going to focus on the other 3 factors on the screen. So first, in order to improve physical health, it's important to eat a healthy diet. The U.S. Dietary Guidelines recently came out with a revision at the end of 2015, and I'm going to discuss some of the key recommendations from that version of the Dietary Guidelines. If you're currently smoking, it's important to stop. You can get benefit from stopping smoking at any time. If you're ready to quit today, please visit this link. IU actually provides a tremendous amount of resources and advice for best ways to try to help people to quit smoking. So please visit this link if you're interested. Additionally, maintaining a healthy body weight is also important for physical health. One way to determine what weight is healthy based on your own height is to calculate your body mass index, or BMI. The CDC provides a website where you can easily calculate your BMI just by entering your weight and height. So if you follow the link on your screen, it'll take you to a website where you first enter your height in feet and inches. There's also an option for metric if you know your height in meters and your weight in kilograms. Okay, so you enter your height and then you enter your current weight and you click on the link for calculate. The website will then pull up your results. It provides your current BMI as well as what a normal weight is based on your height. It gives a range. For example, I'm 5'5". It gives a range of 111 to 150 pounds as a normal weight for my height. So as I mentioned, an updated version of the Dietary Guidelines for Americans was released in December of 2015. One of the key recommendations is to focus on consuming a healthy overall dietary pattern, which includes a variety of vegetables from all subgroups. So this includes orange vegetables, big leafy greens, yellow vegetables. So basically try to make a nice colorful plate of vegetables to make sure you're getting vegetables from all subgroups. And the healthy dietary pattern also includes fruits, especially whole fruits. So not fruit snacks or fruit juices, but really focus on trying to get fruits in their whole form. Another component of a healthy dietary pattern is grains, half of which are at least half of which are whole grains. You should consume fat-free or low-fat dairy and or fortified soy beverages. Finally, you should eat a variety of protein foods, mostly focusing on lean meats and poultry, eggs, seafood, legumes, nuts, seeds, and soy products. And finally, a healthy dietary pattern does include oils, but we should focus on healthy oils that contain polyunsaturated fats and monounsaturated fats. Additionally, to adhere to a healthy dietary pattern, you should try to limit saturated fats and trans fats, added sugars, and sodium. So for those of you who prefer a picture instead of a list of words, this is the Harvard Healthy Eating Plate. In terms of the recommendations, it is very consistent with the 2015 Dietary Guidelines. It does provide a few more examples of what options are healthy and what types of foods you should try to avoid. Importantly, as you can see based on the plate, you will notice that at least half the plate is vegetables and fruits. So for any given meal, you should try to consume at least half of your plate in terms of vegetables and fruits, and then comprise the rest of the plate with whole grains and healthy proteins. The website for the Dietary Guidelines does provide examples of how to shift from having less healthy foods to more healthy food choices. For example, if you're consuming full-fat dairy products, try to shift to either low-fat cheese or low-fat milk. If you're currently eating white bread, then you can try to shift to whole wheat bread or some other form of whole grain bread like oats. If you currently consume a lot of red or processed meat, try to shift to either seafood or beans. For fats, it's recommended that people consume more olive oil or canola oil instead of butter. Soft drinks, particularly those that are sweetened with sugar, are not recommended, and you should try to drink either water, coffee, tea, or milk. And finally, trying to improve on snack choices. Nuts are a fantastic source of protein, so trying to shift from eating something like potato chips to unsalted nuts instead would be a good choice. So there's one more factor that I haven't mentioned yet, but is critically important to your physical health, and that is sleep. This might be good news to some of you who think that changing your diet or going out for a run is not a good idea of fun. Most people like to hear that they should sleep more, even though we think we don't have time for it. Research has shown that sleep deficiency is linked to an increased risk of many chronic diseases, including heart disease, kidney disease, high blood pressure, diabetes, stroke, and higher rates of obesity. So how much sleep is enough? Okay? This actually depends on where you are in the course of your life. I think most of us know that children, especially babies, need a lot more sleep than adults. Okay? Importantly, so I've shown the recommended amount of sleep by age. Okay? Importantly, school-age children and teens still need a lot more sleep than we do as adults. And the studies have shown that a lot of kids are not getting the sleep that they need. So if you have small children at home or teenagers, make sure that they're getting to bed early enough before they have to wake up for school in the morning. For us, for adults, we're supposed to get at least 7 to 8 hours of sleep per day. Getting less than that or getting a lot more sleep than that has been shown to be linked to an increased risk of having various diseases. All right, so now I'm going to turn it back over to Dr. Carol Kennedy Armbruster, and she's going to talk more about physical activity and how to incorporate movement into your day.
Hello, Andrea presented some really interesting information, and I think what I'm going to do is sort of present the why and now what do we do. So I think movement equals vibrancy. Those people that I know that move a lot they're just more vibrant. People are like, what are those people doing? And really what they're doing is changing lifestyle. One of my favorite exercise physiologists, Dr. Ostrand, he wrote an article in MedSci Sports and Exercise, and he studied people that lived to be 100. And he said, guess what? They move more throughout their day. So I think that's going to be the theme of my short time here with you. I have two other books on the screen. Spark by Dr. John Ratty, who talks about bringing movement to the schools. It's an excellent book that also associates movement and brain function. And then Steve Jobs' autobiography is really interesting to me because basically what he has done is that a lot of his inventions were when he was out walking. So I think movement has, although it can prevent cardiovascular disease and those things, it also brings us vibrancy. So where are you in your movement? This is a study that looked at average steps. And you'll see that a lot of the occupations on the top are the ones that are pretty common right now. So we wonder why people are sitting so much and we talk so much about sitting. It's because many of the jobs that we used to do have changed to be more sitting based. In fact, there was a great study by Archer et al. That looked at women that worked in the workplace, all women, and they looked all over time from 1960 to 2010 to look at their movement. And you can see whether you worked in the home, outside the home, women in general have moved less. Of course, part of that is that they have changed. This is my husband, Marty, who is doing a squat to get the clothes out of the dryer. I call that functional movement. Some people go to the gym to do that, but we do that around our house too. So I like to think of intentional exercise and lifestyle movement because we've been kind of ingrained to think that we need to work out in a gym. And for some of us, that is a great option. You'll see on my slide Running Roy in the black, who has a sedentary job, but then he will drive to a fitness center, work out, and then go back to his sedentary job. He's met the guidelines for exercise, but what we're learning is that might not be enough. That Moving Mary, who moves throughout the day, the green, she meets the guidelines too. She just does it in a little different way. And then there is Busy Bob, who sits at his desk in the red, and that's probably the alert for cardiovascular disease if you do that. So what we're really trying to give people are options now about what you can do, because many of us think the gym is the answer, but I think there's more to that. So what about 10-minute bouts? A lot of the current research has told us that we're busy, and you see this mom that is very busy, you know, going to work, dropping off her kids. And so we know that 10-minute bouts do work. So doing things with intention throughout the day where maybe you see those stairs, instead of lollygagging up them, you might run up those stairs and then, you know, get some movement in your day, because any movement, it doesn't have to be continuous, but 10-minute bouts we've seen have really been successful for changing risks. You've also probably heard that sitting is the new smoking, and there is some truth to this, that if we sit too much, then our risk is higher for all the cardiovascular diseases. Okay, so let's move. We've been talking a lot about movement, but let's do some movement. So if you want to pull back your chair and just stand up quickly, I'm going to take you through a couple exercises that are shown on your screen right now. At the bottom, you can click on the Healthy IU link, and there are about eight exercises that you can do at your desk. But we'll try just a couple right now. So many of us sit at our desk and we lean forward like this, and that really causes our spine to be flexed forward. So sitting up tall, pulling shoulders over your hips, and standing with your feet shoulder width for a good base, and then just squeezing your shoulder blades back provides some strengthening for those upper back muscles, and also a little bit of relief from all the forward flexion we do all day at our keyboards. The other exercise I'd like to show you is the sit to stand. So I want you to pull your chair in a little bit closer, and you're going to bend your knees and just let your seat just touch the top of your chair, and then stand back up. So these are called sit to stands, and your quadricep muscles are one of the strongest muscles in your body. So we want them to be strong. If you do 5 or 6 sit to stands throughout your day, then you get some quad exercises. So now we're going to add balance, and as you come up, I want you to balance on one leg and hold it for 1, 2, and then do a squat again, lift the other leg, shoulders back, hold it for 1, 2, and do that again, bend down, hold it up, shoulders back for 1, 2, and the other leg, bend down, and lift and hold. You'll notice that these movements are all done at your desk. So moving your body throughout the day is kind of a great way to just give your body a great present. So again, if you want to learn how to do these in more specific detail, or you want to add the other 4 exercises that aren't on here, you can click on the link below. So I'm linking some of the health-related aspects, body weight and diet and behavior and fitness and physical activity. They're all linked together. And the one thing that I have found to be another idea for you as to, you know, how do I go about changing these things, is something we call activity trackers. I have one on right now, and I've been doing a little bit of research on the behavioral aspects of activity trackers that I want to share with you now. So they are the worldwide trend right now. The American College of Sports Medicine put this out in 2016. Wearable technology is helping a lot of people that maybe don't know how much movement they have. If we quantify things, as Andrea did when she was telling you, how many fruits and vegetables and things to eat, when we quantify movement, we're better able to figure out, okay, how am I doing? So there's lots out there. I'm not going to talk about which one is best. I wear a Fitbit, but there's many that are very, very good. I just want to talk to you about what people think about them when they use them. We do know that in terms of business, this is big business. There's an estimate that there's going to be $25 billion spent on wearable devices. We seem to be kind of infatuated with this idea of trying to figure out how much we move, which for us is good. I think it brings a whole other person into the movement brigade. So we have a program called Ready to Move here, where we pair up student coaches with our Healthy IU program, and they get activity trackers, and our students help them learn how to use them. So the data from this that I'm going to share with you right now is from this program where we have employees helping students learn and also gathering some research. So the Ready to Move participants, when they first signed up, we said, what do you think these devices are going to do for you? And they said, oh, they'll motivate me, give me feedback. Afterwards, though, it was interesting. They're called movement trackers, but they do much more. They help you be accountable, but they also track your sleep. And as Andrea was talking about, sleep is really important. So these do more. They're called activity trackers, but there's so much that they do. A lot of our people started the social aspect where they paired up with people. And mainly it increases your awareness about how much you move. So there are strengths and weaknesses to activity trackers. And as you see on the graph, you'll see the strengths. What did the participants like about them? And then what they were frustrated by. I think we're going to see some of the things in red dealt with by the technology industry. But as a fitness professional that's been in this business for about 30 years, I think these are an amazing device that help a lot of people that maybe don't go to the gym feel okay with the fact that they're getting some movement in their day. So it might be something that you want to try if you're trying to figure out, what can I do to get more physically active? Another interesting thing we found in this is we asked some questions about their sitting. And we wanted to see if we could decrease their sitting at work with having a coach and activity tracker. And the first question you see pre-post, we didn't make any difference in their sitting at work. However, when we asked them about their day, we did make a difference, that they started to move more throughout the day. We heard people parking farther and taking their dogs for a walk or taking their kids to the playground. So we know we impacted their time outside of work. But I think our challenge, and this is a challenge that Healthy IU is trying to take on, as are many worksite wellness programs, is to figure out how do we move people in the workplace a little bit more and still allow them to get their work done. And I think that's something that we're going to be learning a lot more about. So overall, I think we need to think differently. Instead of thinking, I got to run to the gym, on the left is a plank in the gym. And that's a great way to strengthen your abdominal muscles, but what about if you just sit a little bit forward on your chair instead of leaning back, and you'll get a little bit of abdominal work. So you could do that for 5 or 10 minutes at your desk. So thinking about different ways to integrate some movement, some strength into your day. And then, we have all these railings. How do we incorporate balance? We can lean on that railing and go up, or we can have good posture, bring our shoulders back, and walk up those stairs with intention and strengthen our core. I think posture is a critical thing to strengthen for us to have long life and vibrancy. So sitting properly, many people ask me, how do I sit properly? So I thought I would put this graph up here that kind of shows you, and many of you probably are looking at it and changing your position, because every time you talk about posture, everyone goes, uh-oh, what am I going to do? There's a little plate there, and that plate represents any kind of something that you could throw on the floor and do that rotation. Because I can't emphasize enough the importance of making that ball and socket joint work, because it gets locked in all day when you sit at a chair. So overall, I think we need to think differently. And my motto has always been, don't steal my steps. So as you see that person that's walking their dog, the dog's getting a lot of exercise, but is the person getting exercise? No. And then we're greeted by these beautiful escalators and elevators, and often the stairs might be right around the corner, but we don't even think, wow, maybe I should take the stairs and get that little 10-minute bow in that I talked to you about. So trying to really change your movement patterns throughout the day, it's a way to include more movement, and I think it's the beginning of trying to say, okay, I'm going to add more movement in my day. And you'll see some inventions on the right-hand side. There's a robot lawnmower that can actually mow your lawn while you're at work. Or we've seen these Segways. Those are computerized walkers where you can tell it, take me to work, and it knows where your work is, and instead of riding your bike or walking, it will take you there. So these devices are choices that you make. Every day you say, okay, am I going to buy this or am I going to buy that? I want you to think about the things that might steal your steps and say, you know what, maybe I am going to mow my lawn, or maybe I am going to walk. That making intentional behavioral decisions can make a huge difference in your life. So we hope you've gained a few insights from Andrea and myself about not only what we need to do for physical health, but also some little suggestions on the how. And I wish you well, and I wish you lots of movement and vibrancy. Have a great day.